CSOAP, cesarean section optimal antibiotic prophylaxis. This is a Tita et al. Paper, came out in 2016 in NEJM. Primary question is whether or not azithromycin given in non-elective cesarean sections could reduce the risk of post-op infection. Primary endpoint was post-op infection, which included endometritis, wound infection, or other infections within a 6-week period after surgery. The background of the paper simply focused on that C-section is the most common procedure formed, and 60-70% of those are going to be non-elective. Out of the non-electives, around 12% are going to have a post-op infection. The population they focused on in the study were singleton pregnancies greater than 24 weeks of gestation who were in labor greater than 4 centimeters or had rupture of membranes who were undergoing a non-elective C-section. They excluded those who had received azithromycin in the past 7 days, those who had the diagnosis of chorio, or if they had been antibiotics during labor, with the exception of GBS. Here's a simple diagram of the demographic population they used to study. Looking at their primary endpoints, we're comparing the prevalence of the process happening in either the azithro group or the placebo group. So their primary endpoint was 6.1% versus 12% with a relative risk of 0.51. For endometritis, it was 3.8% versus 6.1% with a relative risk of 0.62. And for wound infection, it was 2.4 versus 6.6%. Boils down to a number needed to treat was 17 for their primary endpoint and 24 for wound infection. And that's a simple explanation of the results from the CSOAP trial. Hope that helps. The more you know.